Doctor and friends. My name is Putri with student number 200. And today, in this nice occasion, we as SGDP 5 would like to present our student project with the title HIV in Adult. Okay, so that being said, the rest of the presentation are going to be continued by my friends. Thank you.
Okay, so my name is Sarah Prabhunesati with student number of 253 and will explain about the background. So, human immunodeficiency virus or HIV compromise the CD40 lymphocyte cells of the immune system. Virus persists in body fluids such as blood, semen, vaginal secretion, and also breast milk of infected mothers. Transmitted through sexual contact, iatrogenic and parental transmission by unprotected sex with infected person, multiple different partners, sex workers, or drug user when injecting in drug using non-sterile needle. Also tattoo or piercing and blood transfusion. The disease is still being a big cause of deaths around the world with the growth of 1.8 million new infections in 2016 and increasing in recent years. Essential for patients to be supported from multiple aspects. One of them are family support. By knowing what is HIV, family medicine could be taken as an approach to support patients with HIV in their adulthood by taking multiple approaches.
Good morning, doctors and friends. My name is Tiara with student number 105. For the definition of HIV, human immunodeficiency virus or HIV is an enveloped retrovirus with two single-strand RNA that is known to cause the acquired immunodeficiency syndrome or AIDS, which is the last stage of HIV. HIV targets the immune system of the host that increase the susceptibility of the host to acquired infection that is usually not lethal to non-immunocompromised patients. Based on the genetic characteristics of the disease, HIV is classified into HIV-1 and HIV-2. HIV-1 is the most common type of HIV infections, which accounts up to 95% of the case, while HIV-2 is uncommon and less infectious and found commonly in West Africa. Next, for the epidemiology, HIV incidence shows increasement in the last decades in several regions. In 2019, the incidence rate in the United States increased with a total of new cases increasing from 48,175 new cases in 2010 to 67,000 persons in 2019. According to Joint United Nations Program on HIV/AIDS or UNAIDS, about 500 new HIV infections occur daily. As for the prevalence in 2019, the global prevalence of HIV/AIDS is 36.9 million cases with a prevalence rate of 476 per 100,000. The increasing number of prevalence can be caused due to increasing survival rate with ART treatment. Mortality rates of HIV is also known to decrease globally. In 2018, 700,070 people is known to have died from HIV-related infections. HIV is most commonly affecting those in the age group of 20 to 39 years old. The incidence of new cases is similar among both genders. However, female have more prevalence rate and male have a higher mortality rate. Thank you.
My name is April, student number 237. So I would like to continue explaining about the signs and symptoms of HIV. HIV has a number of symptoms. The symptoms will not be the same for everyone. Depending on the individual and the stage of condition they are experiencing, there are three phases and some potential symptoms are listed. The first one is acute HIV. The flu-like symptoms can be included such as fever, chills, night sweats, muscle aches, sore throats, swollen lymph nodes, and also mouth ulcers. The second one is clinical latency. In this stage, the virus still multiples but at very low levels. People in this stage may not feel sick and have any symptoms, so people can remain in this stage without HIV treatments for like 10 to 15 years. However, some people pass through it more quickly. The third one is clinical latency. The symptoms of AIDS can include such as a rapid weight loss, recurring fever and profuse night sweats, extreme unexplained tiredness, diarrhea for less than a week, sore throat, mouth, anus and genitals, pneumonia, memory loss, depression, and other neurological disorders.
Hello, my name is Putra Binama Sadana Arpika, student number 239. I will explain about the risk factors of human immunodeficiency virus in adults. So individuals are more likely to get HIV if they engage in the following behavior and conditions such as having anal or vaginal intercourse without a condom, having a different STI such as syphilis, herpes, chlamydia, gonorrhea, or bacterial vaginosis, participating in dangerous drinking and drug usage while engaging in sexual activity, while injecting drugs, exchanging infected needles, syringes, and other injecting supplies, and then undergoing medical procedures that sterile cutting or piercing, hazardous infection, blood transfusion, and tissue transplant, and last, suffering unintentional needle stick wounds, even among medical professionals. So that's it. Thank you.
Good afternoon, doctor and friends. My name is Vanessa L, student number 121. Diagnosis of HIV in adults could be done through several investigations that are listed below. The first one via anamnesis and physical examination. Most HIV-infected patients remain asymptomatic post-exposure, but if symptomatic, they are called acute retroviral syndrome, which has non-specific symptoms such as fatigue, muscle pain, skin rash, headache, sore throat, swollen lymph node, joint pain, night sweats, and diarrhea. Chronic infection of HIV can be specified either with AIDS or without AIDS. Chronic infection of HIV with AIDS is defined when the CD4 cell count is under 200 cells, or if there are any AIDS-defining signs and symptoms related to the opportunistic illnesses, regardless of the CD4 cell level. The signs and symptoms include recurrent bacterial infections, recurrent pneumonia, candidiasis, coccidioidomycosis, extrapulmonary cryptococcus, chronic intestinal cryptosporidiasis, cytomegalovirus disease, HIV-related encephalopathy, herpes simplex with chronic ulcers, chronic intestinal isosporiasis, any mycobacterium infections, pneumocystis jirovecii, and others. Chronic infection of HIV without AIDS could be characterized by thrush, vaginal candidiasis, oral hairy leukoplakia, herpes zoster, peripheral neuropathy, bacillary angiomatosis, cervical dysplasia, cervical carcinoma in situ, idiopathic thrombocytopenic purpura, and others. And there are many ways to diagnose HIV infection, and this additional examination could be used for early diagnosis of HIV. The first one is fourth-generation immunoassay for detecting specific antibodies and viral nucleic acid by the presence of P24 HIV antigens within 2 until 3 weeks post-infection. The second one is rapid test for quick detection of HIV infection using patient's blood or saliva. The third one is PCR for diagnosing HIV infection by detecting viral nucleic acid and providing the viral load counts.
Hello, doctor and friends. My name is Nuputu Sasotasha Widaputri, student number 224, and I will explain the family interaction in patients with HIV. Now, HIV can cause disturbances in the emergence of psychological and emotional disorders. Guilt, self-stigma, cost of living, cultural and religious issues, anxiety, and depression are commonly found in people with HIV. These can lead to serious health problems. Thus, the families should not reject them and avoid them. Instead, give them emotional and financial support to them because they are in need of as much support as they can have, especially from the families that are the closest to them. Thank you.
Hello, doctor and friends. My name is Duna Ulisi Dauro, student number 165. The impact of HIV to family is largely affected by HIV-related self-stigma among people living with HIV/AIDS and their family members. It creates an imbalance of power and social inequality which adversely impact on them and their family members' behavior, physical and psychological health quality and outcomes, social functioning, and well-being. Due to ignorance and inaccurate information about HIV-related stigma remains prevalent and leads to the emergence of moral judgment, stereotypes, and discrimination of HIV patients and their families. Stigma can consequently cause internal family problems, including conflicts, family quarrels and disputes, blaming each other, or even verbal and physical abuse. And also problems in external social environment of the family include social rejection, social gossip, social isolation, unemployment, loss of identity, verbal abuse, or even human rights violations. Stigma can also provoke adverse social determinants of health that cause worse health outcomes in family due to inequality of health services, low access to healthcare, refusal of treatment or mistreatment by healthcare providers, and violation of confidentiality. Another impact of HIV to family are economic difficulties and physical and mental health issues of family. Decadence in the physical and mental health quality occurs because of the dual burden borne by family members, which must be caring for the patient and while at the same time managing stigma and discrimination against them. Thank you.
Hello, doctor and friends. My name is Shanti Dewi, my student number 142. There are 4 main pillars supporting family medicine and primary health care: preventive, collaborative, continuing, and also comprehensive care. So comprehensive care is a holistic approach, meaning that it covers aspects not limited to patients' medical and physical needs, but also their psychosocial and economic condition. Also, the disease's impact for the whole family. As HIV is a very complex disease which can affect almost all aspects of patient's life, comprehensive approach is thoroughly needed. So the first aspect that I will talk about is the medical aspect. Primary healthcare personnel are responsible for detection of arising medical problems, as they will be the first to be contacted by the patients and then the initial management for those problems. Also, observing patients' adherence to ART as it needs to be consumed daily and regularly to achieve the best results. And then chronic disease primary management on later stages, also supportive and palliative care. Moving on to the economic aspect, as we know, treatment for HIV or AIDS are not cheap, and antiretroviral therapy, aka ART, needs to be consumed daily. So it is economically burdening, especially for the poor or unemployed. So to tackle this problem, actually governments and various countries have released programs for HIV prevention, also fundings for ART or some other HIV-related costs. In Indonesia, BPJS doesn't include ART funding in their program, but the government provides free ART for all in various public health centers or hospitals. And our role as family physicians is to guide and direct patients on how to apply for the program and informing patients about where they can get them. And so lastly, the psychosocial aspect. HIV or AIDS is still highly stigmatized. People with HIV or AIDS get judged regarding how they contracted HIV. They get mocked. People around them, friends, and even families are building barriers around them, too scared to get close. Firstly, getting infected with HIV is already something very hard to accept. How would they even feel, receiving further stress and psychosocial burden from the stigma? How then may medical personnel help them in this aspect? So first, they can provide supportive consultations or counselings for both patients and family, as people living with HIVs, their family included, shared the psychosocial trauma, the psychosocial burden. Medical personnel may also help by connecting patients with support groups, as they might feel more comfortable and comforted around those who share the same problem with them. And lastly, they can be a good friend for the patient. As medical personnel are deemed as trustworthy and accountable figures regarding health topics, they can also educate and advocate to help deal with the root of the problem, the stigma around HIV, to raise awareness and stopping the stigma around HIV little by little. Thank you.
Hello, my name is Ayu, student number 173. Moving on to the collaborative approach for HIV in adults. It is said that effective clinical practice requires great team collaboration. Poor collaboration will lead to unclear orders, miscommunication, and other problems in providing healthcare services, especially for patients with complex diseases such as those with HIV. Next slide. Collaboration in providing healthcare services can be seen in prevention and curative intervention. First, we'll discuss prevention. Commercial sex workers is the first group at high risk for contracting HIV. In this part of discussion, we'll be focusing on the role of collaboration in prevention for this specific group. Here's the structure of the instrument in the HIV/AIDS approach for commercial sex worker community. As you can see, the structure tells us that the first step of this approach is community empowerment. Through community empowerment, all programs will be implemented properly, whether that will be addressing violence against sex workers, community-led services, condom and lubricant programming, etc. This shows that collaboration is not always a group of health workers who are treating a patient, but also when a community empowers each other and be the root of prevention itself. Next slide. Other than prevention, curative interventions are also available for those who already have HIV. HIV patients often come with more than one diseases, so medical personnel with different specialists are needed to treat one patient. In this discussion, we'll take the case of HIV patients with depression. This is the collaborative care model for HIV patients with depression. As you can see, there are three main health providers that communicate with each other in order to provide the best service according to the patient's condition at the time. Those three providers are primary care provider, care coordinator, and a specialist, and in this case, a psychiatrist. The role of psychiatrist can be replaced with other specialist doctors depending on the disease suffered by the HIV patients. Next slide. Overall, whether it's prevention or curative, optimal service for patients with HIV can be achieved by implementing interprofessional collaborative practice or IPC. How do you exactly implement IPC in healthcare services is by fulfilling several elements of IPC. Those elements are responsibility, accountability, coordination, communication, cooperation, assertiveness, autonomy, and mutual respect and trust.
My name is Esther Pemayon with student number 252. The concept of continuum of care involves an interconnected system of care that directs and monitors patients over time as they receive a wide range of health services covering all degrees of intensity of care. The goal of the continuum of care is to provide integrated services on an individual basis by integrating and facilitating transition between providers through case management and interdisciplinary treatment teams. The continuum of care has been presented as a framework to demonstrate the sequential steps or stages of HIV care route that people living with HIV go through, from infection to initial diagnosis, ART administration, viral suppression, and also include linkage to and retention in care. The continuum care of HIV enables healthcare professionals, researchers, and decision makers in the field of HIV to better comprehend the obstacles and factors that contribute to successful care of outcomes. Holistic and patient-centered approaches for HIV patients with cooperative collaboration of different stakeholders have the potential to improve health, well-being, and quality of life in various aspects such as physical, physiological, spiritual, and social. Primary care physicians such as family doctor is critical when providing continuity of healthcare. The family physician as the first contact for healthcare needs to help patients to navigate, manage, and understand their illness. Family physicians also help patients to prevent and set health goals in their healthcare. Interprofessional collaboration team-based practice is also needed to avoid fragmentation in continuity of healthcare. This approach is aimed to maximize the capacity, strength, and skill of multiple health workers from different professional backgrounds. Interprofessional collaboration in healthcare help to improve health outcomes, avoid errors, and achieve optimal health services. Family also has important role to help continuum care of patients with HIV. Family support have shown positive impact in multiple aspects of the patient life. As the closest member to the patient, family support such as encouragement, good communication, healing, and family recreation could help HIV patients to conquer their tremendous social pressure and discrimination. More importantly, family support help patients to develop sense of responsibility about their thought and their future. Not only the family, community role also important help patient care with HIV. We need to stop discrimination, stigmatization of HIV, and help them reconnect with their community. Government also needs to provide social welfare and health service through collaboration in multisectoral, comprehensive and integrated program, regulation and authorization in response of HIV. Family physician and government could collaborate to achieve highest level of participation and compliance patient with HIV by communicating, educating, and recruiting family members and community to help the process. This action will encourage the patient to participate more fully in the healing process and monitor them to take their medication regularly. Through this collaboration between health workers, family, community, and the government could help patients with HIV improve and achieve their highest level quality of life. Thank you. Next.
Hello Dr. and friends, my name is Pindiferal Valentin with student number 086. The prevention of HIV in adults can be divided into three, which are primary, secondary, and tertiary prevention. The primary prevention is more targeted at individual and community approach. This is the best effort in suppressing the increase in the incidence of HIV cases. The examples are health promotion, which is the intellectual effort for the target community to improve knowledge and perceptions, and specific protection such as using condom consistently and using sterile injection. And then the next is secondary prevention. This is aiming to reduce and minimize the prevalence of the disease with a fairly short duration of time. The examples are early detection of HIV in the high-risk groups, namely sex worker, and proper treatment such as ARV therapy should be monitored by monitoring the result of the laboratory tests such as HIV RNA and CD4 plus T cell counts. And the last one is tertiary prevention. This is aiming to limit the effect of the disease that can occur in a relatively long period of time and also improve a person's quality of life to be better. Examples is usage of ARV therapy to inhibit the development of the HIV virus. Thank you.
My name is Nanda Pramesti with the number 167. So for the summary for our student project, HIV case is until now is still high and make mild health problems because the increasing of case. HIV is mostly found in reproductive age between 20 until 39 years old. Across all the time, HIV is a chronic disease, which means it's gradually affecting the host immune system until the CD4 go down, and makes external infection can enter the host immune system, so the person go to being in its phases. Many factors can make someone having HIV virus, especially with contact or close contact with their body parts that contain HIV virus, likely sexual multiple partner, parental transmission, using monster needle, and also tattoo. In the first place, someone with HIV virus is not feel the red symptom because it's commonly like a common cold. So the people symptom like fever, chill, stress, fatigue, and others. But HIV is not always a physical problems because until now stigma can more easily spread in our community and make the patient and their family feel physical health problems. So it's need to take concern of our as a physician to approach in family medicine. So we have to constrain in comprehensive, collaborative, and also continued. It's not always we as a physician to make the help the patient problem, but also we need to take our interprofessional like the nurse and you're also like public health, and it's make our student project concerned with these cases of HIV. Thank you.
Okay, so that's all for the presentation. We would like to apologize if there are any mistakes and something that is lacking from our presentation. Thank you for your nice attention. Goodbye.